Assalamualaikum warahmatullahi wabarakatuh. Alright, I'll be talking about how to use the sphygmomanometer. First of all, we need to know what is the function of sphygmomanometer. Sphygmomanometer is an instrument for measuring the blood pressure. It consists of inflatable rubber cuff, this one, which is wrapped around the upper arm and is connected to an apparatus that records the pressure, which is this one. Usually we see this kind of sphygmomanometer, which is the mercury type. Alright, usually in terms of the height of a column of mercury or on a dial, and which is the aneroid manometer. So how to read it is we basically need to read the height of the mercury. That will show the blood pressure of the person. Alright, so in the interpretation of the reading of the sphygmomanometer, we need to know that using the sphygmomanometer or maybe the blood pressure reading consists of systolic pressure and diastolic pressure. So if a person which is a normal person, the reading is 90 to 120, 60 for the systolic pressure, and 60 to 80 millimeter mercury for diastolic pressure. So that's the normal range. For hypotension, the reading for systolic pressure is below 90 millimeter mercury, and for the diastolic pressure is below 60 millimeter mercury. For pre-hypertension condition, or we can say a patient that nearing to getting hypertension, we need to take caution, is 120 to 139, or maybe you can say 131 to 139 millimeter mercury for the systolic pressure. For the diastolic pressure is 81 to 89 millimeter mercury. For stage 1 hypertension, the systolic pressure is 140 to 159 millimeter mercury. For the diastolic is 90 to 99 millimeter mercury. For stage 2 hypertension, which is a chronic condition of hypertension, the systolic is above or 160 and above millimeter mercury. For diastolic pressure, 100 and above millimeter mercury. Things needed to avoid during taking the blood pressure: places the cuff over clothing, using unsuitable size of cuff for the patient, patient feet is not supported, patient is in full bladder, patient's legs crossed. These are the things that we need to avoid so that the reading is more accurate for the patient. That's all. First of all, we need to check that the cuff is the correct size for the patient. We need to apply the cuff around the arm with the center of the bladder over the brachial artery. Then we need to locate the radial pulse. Then we inflate the cuff until the radial pulse can no longer be felt. We need to take note this pressure on the sphygmomanometer. This is the rough idea of the systolic blood pressure reading. Then we deflate the cuff. And then we need to place our stethoscope at the antecubital fossa on the brachial artery. Then we inflate the cuff to a pressure 30 millimercury higher than the estimated systolic pressure. Then we slowly deflate the cuff at a rate of 2 to 3 millimeter mercury per second until we hear a regular tapping sound, which is the cork sound. We need to record this reading to the nearest 2 millimeter mercury because this is the systolic pressure. And then we continue to deflate the cuff until the sound disappears. We need to record this pressure when the sound is completely disappeared, as this is the diastolic pressure. and that's how you take the blood pressure.